ਗੁੱਡ ਈਵਨਿੰਗ ਗਾਇਜ਼। ਸੋ ਵੈਲਕਮ ਕਰਦੇ ਹਾਂ ਤੁਹਾਡਾ ਨਰਸਿੰਗ ਕਰੀਅਰ ਚੈਨਲ ਦੇ ਉੱਤੇ। ਸਾਰਿਆਂ ਨੂੰ ਰਿਕੁਐਸਟ ਆ, ਪਲੀਜ਼ ਜਿਹਨੇ ਵੀ ਚੈਨਲ ਹਲੇ ਤੱਕ ਸਬਸਕ੍ਰਾਈਬ ਨਹੀਂ ਕੀਤਾ ਤਾਂ ਚੈਨਲ ਨੂੰ ਸਬਸਕ੍ਰਾਈਬ ਜ਼ਰੂਰ ਕਰ ਦਿਓ ਤਾਂ ਕਿ ਹਰੇਕ ਵੀਡੀਓ ਦੀ ਅਪਡੇਟ ਤੁਹਾਡੇ ਤੱਕ ਪਹੁੰਚ ਸਕੇ, ਕਿਉਂਕਿ ਆਪਾਂ ਸਟਾਫ ਨਰਸ ਦੇ ਐਗਜ਼ਾਮ ਦੀ ਪ੍ਰੈਪਰੇਸ਼ਨ ਕਰਵਾਉਂਦੇ ਹਾਂ। ਅਤੇ ਅੱਜ ਆਪਾਂ ਚਾਈਲਡ ਹੈਲਥ ਨਰਸਿੰਗ ਦੇ ਵਿੱਚੋਂ MCQs ਕਰਦੇ ਹਾਂ। ਬਹੁਤ ਇੰਪੋਰਟੈਂਟ ਮਲਟੀਪਲ ਚੋਇਸ ਕੁਐਸਚਨਸ ਨੇ, ਇਹ ਬਹੁਤ ਵਾਰ ਰਿਪੀਟ ਹੋਏ ਨੇ ਕੁਐਸਚਨ ਦੇ ਵਿੱਚ। ਸੋ ਸਟਾਰਟ ਕਰਦੇ ਹਾਂ ਜਿਹਦਾ ਫਸਟ ਕੁਐਸਚਨ, what is the normal suction pressure for suctioning to a term newborn? A 40 to 60 mm of Hg, B 60 to 80 mm of Hg, C 80 to 100 mm of Hg, D 100 to 110 mm of Hg. So what is the normal suction pressure for suctioning to a newborn baby? So newborn baby ਦਾ ਕਿੰਨਾ ਹੁੰਦਾ? 60 to 80 mm of Hg is the right answer. Next question number second, what is the normal suction pressure for suctioning for a preterm newborn? So a preterm newborn ਪੁੱਛਿਆ। A 40 to 60 mm of Hg, 60 to 80 mm of Hg, D C 80 to 100 mm of Hg, D 100 to 110 mm of Hg. So A 40 to 60 mm of Hg ਇਹ ਪ੍ਰੀ ਟਰਮ ਨਿਊਬੋਰਨ ਦਾ ਹੁੰਦਾ 40 to 60 mm of Hg। ਇਹਨਾਂ ਦੋਨਾਂ ਕੁਐਸਚਨਸ ਦੇ ਵਿੱਚ ਤੁਸੀਂ ਕਨਫਿਊਜ਼ ਨਹੀਂ ਹੋਣਾ, ਕਿਉਂਕਿ ਇੱਥੇ ਨਿਊਬੋਰਨ ਦਾ ਪੁੱਛਿਆ ਤੇ ਇੱਥੇ ਪ੍ਰੀ ਟਰਮ ਨਿਊਬੋਰਨ ਦਾ ਪੁੱਛਿਆ। ਨੈਕਸਟ ਥਰਡ, a nurse is accompanying umbilical cord and the nurse known that the distance of first clamp from the umbilicus is A 2.5 cm, B 5 cm, C 7 cm, D 5.5 cm. So 2.5 cm is the right answer. Fourth, maximum score of Apgar scoring is. So maximum score of Apgar score is A 8, B 10, C 13, D 23. So it option B 10. Maximum score of Apgar score is 10. B is the right answer. Next question fifth. Most important component of the Apgar score is. So what is the most important component of Apgar score is? A heart rate, B respiratory rate, C grimace, D skin color. So heart rate, A is the right answer. Heart rate is the most important component of the Apgar scoring. Next question number 6. If Apgar score is 6 just after the birth of baby, which intervention is appropriate for this baby? So ਉਹਨਾਂ ਨੇ ਪੁੱਛਿਆ ਜੇ Apgar score 6 ਹੋਵੇ just after birth of the baby, so which intervention is appropriate? A normal routine care, B oxygen therapy and stimulation, C resuscitation, D none of the above. If Apgar score is 6, so oxygen therapy and stimulation provide to the baby. B is the right answer. Seventh, which colors identification band is used for girl newborn? So which color identification band? Newborn girl, blue, B pink, C red, D green. Pink is the right answer. Next, eighth, breastfeeding should start within how many hours after a normal delivery? So breastfeeding ਆਪਾਂ ਨੂੰ ਕਦੋਂ ਸਟਾਰਟ ਕਰਨ ਦੇਣੀ ਚਾਹੀਦੀ ਆ? After a normal delivery. A within a half hour, B within 4 hour, within 24 hour, D within 2 hour. So breastfeeding ਆਪਾਂ ਨੂੰ within a half hour ਸ਼ੁਰੂ ਕਰ ਦੇਣੀ ਚਾਹੀਦੀ ਆ। A is the right answer. Ninth, route of administration of vitamin K injection in a newborn. So ਕਿਹੜੀ ਰੂਟ ਰਾਹੀਂ ਆਪਾਂ ਨੂੰ ਐਡਮਿਨਿਸਟਰ ਕਰਨਾ ਚਾਹੀਦਾ ਵਿਟਾਮਿਨ K in a newborn? A subcutaneous route, B intramuscular route, C intradermal route, D intravenous route. So intramuscular route is the best route of administration of vitamin K injection in a newborn. So injection vitamin K is given to a newborn baby to prevent bleeding and dose is 0.5 mg to 1 mg. Route is intramuscular. So B is the right answer. 10th, What is the normal temperature of a term health newborn? So what is the normal temperature in newborn baby? A 36 to 37 degrees centigrade, B 36.5 to 37.5 degrees centigrade, C 37.5 to 38.5 degrees centigrade, D 38 degrees centigrade. So right answer is 36.5 to 37.5 degrees centigrade is the normal temperature of a term health newborn. 11th, normal average length of a term healthy newborn. So what is the normal length of healthy newborn is A 40 centimeter, B 50 centimeter, C 60 centimeter, D 65 centimeter. So normal length is 50 centimeter. ਸੋ ਇਹ ਬਹੁਤ ਜ਼ਿਆਦਾ ਇੰਪੋਰਟੈਂਟ ਕੁਐਸਚਨਸ ਨੇ, ਇਹ ਜ਼ਰੂਰ ਤੁਸੀਂ ਵੀਡੀਓ ਇੱਕ ਵਾਰ ਜ਼ਰੂਰ ਦੇਖ ਲਿਓ, ਕਾਫੀ ਵਾਰ ਕੁਐਸਚਨਸ ਇਹ ਆਏ ਨੇ ਐਗਜ਼ਾਮ ਦੇ ਵਿੱਚ। ਨੈਕਸਟ ਆਪਾਂ ਚੱਲਦੇ ਹਾਂ 12 ਤੇ। ਜੁਆਇੰਟ ਬਿਟਵੀਨ ਟੂ ਕ੍ਰੇਨੀਅਲ ਬੋਨਸ ਆਰ ਨੋਨ ਐਜ਼ ਫੋਂਟੈਨੇਲੇ, ਬ੍ਰੈਗਮਾ, ਸੀ ਸੂਚਰਸ, ਡੀ ਸਕਲ ਜੁਆਇੰਟਸ। ਸੋ ਜੁਆਇੰਟ ਬਿਟਵੀਨ ਟੂ ਕ੍ਰੇਨੀਅਲ ਬੋਨਸ ਆਰ ਨੋਨ ਐਜ਼ ਸੂਚਰਸ is the right answer. 13th, anterior fontanelle is also known as lambda, B bregma, C vertical, D none of the above. So bregma is a anterior fontanelle, B is the right answer. 14th, posterior fontanelle fuse at the age of A 6 months, B 12 months, C 6 year, D 6 weeks. So posterior fontanelle fuse at the age of 6 weeks. D is the right answer. 15th, which statement is wrong about caput succedaneum? A can cross suture line, B always present at birth, C occurs due to improper venous drainage, D can't cross suture line. So can't cross suture line is a wrong statement about caput succedaneum. Next 16th, which statement is right about cephalomatoma? A can cross suture line, B always present at birth, C occurs due to improper venous drainage, D can't cross suture line. So which statement is right? D can't cross suture line is the right statement about cephalomatoma. 17th, red reflex test is used to identification of which pathological condition? A glaucoma, B Down syndrome, C cataract, D otitis media. So red reflex test is used to identification of which pathological condition? Cataract is the right answer. 18th, the nurse is assessing a newborn during eye examination. Which assessment finding is abnormal about normal pupil? A equal pupils, B in round stage, C reactive light, D non-reactive to light. So non-reactive to light is the right answer. Next 19th, torticollis occurs due to damage to which cranial nerve? A 5th cranial nerve, B 7th cranial nerve, C 9th cranial nerve, and last is 11th cranial nerve. So torticollis occurs due to damage of 11th cranial nerve is the right answer. 20, initial sign of respiratory distress is cyanosis, grunting sound, C nasal flaring, D tachypnea. So initial sign of respiratory distress is nasal flaring. C option is the right answer. 21st, Alice sign is associated with A epispadias, B critocidism, C development dysplasia of hip, D Down syndrome. So Alice sign is associated with development of dysplasia of HIP. C is the correct option. 22, Which birth require cosmetic surgery in future? So A. Telangiectatic never. B. Nevus flammus. C. Nevus vasculosus. D. Mongolium. So which birth require cosmetic surgery in future? Nevus flammus. B is the right answer. Next question number 23. Which assessment finding is not related to preterm newborn? A. Soft ear pinna. B. Wernicke scissosa covers whole body. C. Long nail. D. Low birth weight. So, long nail is the right answer. Long nail is the right answer. Next, 24th. What is the first assessment of the newborn? So, what is the first assessment? A. Suction. B. Initiation of respiration. C. Apgar scoring. D. Physical examination. Initiation of respiration is the right answer. 25th. Vowel sounds should present within how many hours after birth? So vowels sound should present within how many hours after birth? A. 1 hour. B. 4 hours. C. 24 hours. D. 12 hours. So after 1 hour is the right answer. So these are the questions today I will discuss in child health nursing. These are the very important MCQs. So please subscribe the channel and like the videos. So thank you, ਮਿਲਦੇ ਆਪਾਂ ਅਗਲੀ ਨੈਕਸਟ ਵੀਡੀਓ ਦੇ ਵਿੱਚ।